The menstrual cycle is the most important natural phenomenon occurring in a female. It is present in all the animals. It ensures the passage of DNA from one generation to the other. It is a complex phenomenon involving the mind and the body. There are different hormones which act in harmony to ensure that this cycle, as we call it, is the menstrual cycle. The cycle continues. The normal menstrual cycle is for 28 days on an average, but anything plus or minus 7 days is considered to be normal. So 21 days to 35 days is considered normal. But as I said, on an average, it's about 28 days. Sometimes women may tell you that they have periods erratically. So sometimes it's a 28 to 21 day cycle, sometimes it's a 32-day cycle. They're all normal. You don't have to investigate as long as they've got it's a cycle which is falling in that range. It's entirely normal. Um, the different hormones which partake in the menstrual cycle, they usually start their functioning at the time of puberty, and when the periods begin, we call it menarche. Menarche on an average is between 11 to 13 years, but it can be as early as 9, can be as late as 15. Not uncommonly, it can be greater than 15, although it's, as I said, I mean, it's not uncommon, but nevertheless, it's usually between 11 to 13 years. The hormones are already present, but as the body clock goes, the hormones actually increase in their volume, and that's where all the cyclical fashion takes place. The most important hormones which play a part are the follicle stimulating hormone, the luteinizing hormone, estrogen, and progesterone. So you just have to remember these four: FSH, LH, estrogen, and progesterone. The FSH and LH, they are produced from the anterior pituitary gland, along with some of the other ones. There are on an there are in total six hormones which are produced from the anterior pituitary. There are two from the posterior pituitary. Of the six, which include the growth hormone, thyroid stimulating hormone, ACTH, FSH, LH, and prolactin, there's another one, the seventh one, which is melanocyte stimulating hormone, although it's produced somewhere in the middle between anterior and posterior pituitary. Of these, the four most important ones, and thyroid, the ACTH, TSH, and LH. These four have got a suprapituitary control as well in the hypothalamus. So it tells you how important these four hormones are, and how normal life and normal physiology will be affected if these hormones weren't working properly. And that's why nature has given additional control of these four hormones to the brain itself, that is, to the hypothalamus. You don't have a similar control of a growth hormone in the hypothalamus, because even if there is growth hormone deficiency, it doesn't make a difference. Likewise, for prolactin, it won't make much difference. But yes, if ACTH was low, if thyroid was low, or the FSH was low, then indeed it will make a difference. The hormones, as I said, they're present, but there is a surge in these hormones at the time of menarche. It's just like you plant a seed, and the seed will be there. The plant will grow into a tree, but will not bear fruit until a certain time that we know that it's going to be after 5 years or 6 years, and that's the similar body clock that is present in a woman. The importance of menstrual cycle in clinical diagnosis for a physician can be judged from the fact that if there was anything seriously wrong with the body, for instance, there was a serious underlying illness like autoimmune disease, or for instance, cancers, or chronic liver disease, or chronic heart disease, or lung disease, the menstrual cycle will be disturbed. So before you proceed on to doing complex medical tests, medical scans in a patient who appears to be unwell, has a history of long-standing fever or weight loss or anything else that you cannot actually put your finger on, always ask about the menstrual cycle. If they've got regular periods, rest assured this patient does not have a serious underlying illness. And this is a critical question which unfortunately physicians ignore. They don't tend to ask this. They don't really weigh this, the importance of this particular question. So if they've got normal periods, They are unlikely to have serious underlying illnesses. So, what is the menstrual cycle? It's for 28 days, comes in a cyclical fashion. The most important hormone, as I've said, is the FSH. Now, I'm going to tell you about these hormones. So we've got the FSH, that's follicle stimulating hormone. Hormone, as we know, are proteins which act distantly and they have an effect on the end organs. And then we've got luteinizing hormone. Luteinizing hormone. The follicle stimulating hormone, as the name indicates, it's a follicle, it's stimulating, and it's a hormone. So it stimulates a follicle. Now we know that FSH and LH both are present in males as well. They're not only present in females. So in the females, the FSH is released, works on the ovary, stimulates a follicle. What is a follicle? First, you've got an egg, and when the FSH works on it, it tends to increase in size, and this accumulates fluid. I'm just going to call it water, but it accumulates fluid. And when it accumulates fluid, this becomes a follicle. So follicle is an egg with a surrounding fluid. The FSH stimulates an egg, the egg increases in size, becomes a follicle, and then ultimately then the follicle opens up, the egg is released, and the remaining part of the follicle, say for instance, so this is the place from where the egg went out. The remaining part is called as the corpus, as in corpuscle, corpus luteum, and this is involved with release of progesterone. Often it is confused whether progesterone is present as such along with the estrogen. No, indeed, it's not. The progesterone only comes when the corpus luteum is formed. That means the egg is there and the egg is released from the follicle. And when the egg is released from the follicle, it tends to produce afterwards progesterone. So the follicle stimulating hormone is present in the cyclical fashion, and then comes the luteinizing hormone. The luteinizing hormone comes in the latter part of the menstrual cycle, and the job of the luteinizing hormone are two. So it's got a very important and a critical job. Number one job for the luteinizing hormone is that it gives that sudden push, the sudden jump in the follicle, and the egg pops out. So it is involved with ovulation. Ovulation means ova and lation. So ovulation, the ovum, it actually lays, it comes out of the follicle, and this suction, this push, this is caused by the luteinizing hormone, by the surge in the luteinizing hormone. This is the only job that the luteinizing hormone does in the ovary. This is what it does. It actually stimulates that. Yes, it does have indeed another function as well in the production of estrogen and androgens as well. But for practical purposes, luteinizing hormone, it causes surge in ovulation. But not only that, then it goes down and acts on the uterus. And then it starts to change the uterus. So the uterus becomes thick, it becomes soggy, starts to mature, starts to have more blood in it in anticipation for a fertilized egg. So if the egg is fertilized, which happens in the fallopian tube, so the egg is fertilized, the luteinizing hormone makes sure that it has a soft landing. It comes and then it gets embedded inside the uterus, and this is the job of the luteinizing hormone. The luteinizing hormone stays for a while. The job is then taken over by the progesterone. So once this happens, progesterone, which is released from the corpus luteum, then it takes over this, and then it carries it on for several weeks till the job is then taken over by the placenta. So you've got the FSH and then you've got the LH. Now, let me tell you how the menstrual cycle works. Say, for instance, if a woman had her periods, they started on the first of the month. I'm going to divide it into different sections. So, this is day 1, this is day 7, this is day 14, this is day 21, and this is day 28, followed by the same cycle again. On the day 1, that is when the period starts, the flow starts, the normal average time for the menstrual flow is 3 to 5 days. This is the average time. So it can be less, it can be 3 days, can be 4, can be 5 days, it can be longer than that, can be even 6 or 7 days even. But this is considered to be the normal one. So 3 days, 5 days, 6 days, or up to 7 days. So this is considered to be the normal blood flow. So the blood flow starts here on the first, and then with the blood flow, then you've got the follicle stimulating hormone increases. That's what the first 14 days are called as the follicular phase. The second 14 days are called as the luteal phase. Why is it called the first 14 days is the follicular phase? Because this is the phase when the follicle is going to mature. And that's why it's called as the follicular phase. On day 14 is ovulation. When ovulation takes place, that is the end of the follicular phase, because now the follicle has developed, the egg has been released. So that is the end of the follicular phase. Do not take it beyond. Then begins the luteal phase, and the luteal phase is the one in which, if there was pregnancy, the ovum is going to get settled, and this is the phase when the other hormones are going to take place, and that is the LH, which actually had a surge here, and then you've got the progesterone, and the progesterone is here because progesterone makes sure that the egg is embedded properly. Um, a thing to remember, and that is the luteal phase is usually constant, 14 days. If you remember this particular fact, then it will be easier for you to determine the length of the cycle as well as the safe period, because a lot of your patients will ask about the safe period when they can have intercourse without becoming pregnant. And those safe periods are actually they depend on the timing of ovulation, but the luteal period. So the luteal phase, which is the second half of the menstrual cycle and ends just before the first day of the period. So this is the luteal phase on this side. The luteal phase is constant at 14 days. So if the period was, say for instance, to occur on the 15th of the month, 14 days before that is going to be the luteal phase, and this usually remains constant. The follicular phase may shift, it may vary, but not often the luteal phase, although it's said that it can vary by 1 or 2 days, but nevertheless, we have to remember the luteal phase is fairly constant. So what happens in the follicular phase? In the follicular phase, on the first day, the FSH begins to rise. So this is day 1. The FSH begins to rise and it keeps on rising. On day 7, estrogen begins to rise. So now you've got an elevation in FSH and then you've got an elevation in estrogen. The estrogen has got numerous functions. First of all, it takes part in follicular maturation, but it also takes part in preparation of the uterus, as well as the secondary sexual characteristics. Along with that, then you've got the change in body in general, all in preparation for an expected pregnancy. And imagine this occurs 12 times in a year, and for the lifetime, for the reproductive lifetime of a female. So all this cyclical fashion that keeps on going on and on and on, and you can calculate how many times it occurs till the age of menopause, which is usually 51 years, and how many times in those years, this particular thing happens again and again and again. So they begin to rise. Estrogen begins to rise from day 7. FSH begins to rise from day 1, and then they peak around day 13. On day 13, this is day 13. On day 13, you've got the LH, which now comes. Bang! The LHS fixes the follicle and pops out the ovum. The FSH couldn't do that, estrogen couldn't do that, so they needed additional support from LH. So the LH comes on day 13. The luteinizing hormone doesn't really have a role to play before that. So it comes up, pops the egg, and then it drops down. So it only was there to do one job, and that was to get the egg out of the follicle. So the LH comes up on day 13, pops out the ovum, and falls again after 24 hours. So LHS is gone. You don't need to know about that anymore. The FSH, now it begins to drop. So it was falling, now it begins to drop, and then it goes down because it's not needed anymore for the remaining part of the cycle, which is a luteal phase, because that was only for the follicular stimulation. Follicular stimulation has occurred, the follicle has opened up, the egg has been popped out, so you don't need the FSH again. FSH now begins to fall, and there is a reason, there is a purpose for that. The purpose is when the FSH begins to fall, the ovary, which has several numerous eggs or follicles which are probably going to mature, they all die out. The female is born with millions of eggs, and they're all formed at the time when she's still not born. She's still in the mother's womb, and when she grows up, these follicles begin to mature at different rates, at different speeds. But there's a constant phenomenon in which the follicles will keep on dying. So there are millions of follicles, and then this is her reserve. Now, if the reserve is depleted because of illness, if the reserve is depleted because she has premature ovarian or she has got some autoimmune disease, once she loses that reserve of the eggs will go, and then she may become infertile at the age of 30 or even at the age of 25, and this is something which unfortunately can occur if they've got illnesses or they're actually born with low follicular or the low ovum load. In one cycle, about 20 eggs pop up and they want to mature. About 20 eggs. Out of those 20 eggs, usually there's one egg which supersedes the rest, and so it increases in size. The remaining eggs, about 19 eggs, they lag behind, they don't increase in size. So the FSH big works on all of them, but works more on this one because this is a super smart egg, this one. So when the FSH drops down, these eggs are starved of FSH. So the remaining 19 eggs are starved of FSH, and then they'll die. They'll be gone. And this one egg will remain, and this one egg is then going to produce the ovum, and then the corpus luteum, and so on and so forth. So this is the advantage when the FSH falls down, that it makes sure that these eggs die out. So the eggs die out, there is no competition, nothing happens, and the whole body is then going to concentrate on that one remaining ovum which was released. Now, whether or not that is fertilized is another issue, but the FSH goes down. The estrogen, on the other hand, which had a surge here just before ovulation, the level of estrogen comes down, and then it has another surge later in the luteal phase, and then at the time of periods, the estrogen drops down again. Now, there is a term which can be called, which can be thought of as in a negative way, and that is premenstrual tension. Now, why is it called as premenstrual tension? Whether some believe it in it or not, but it is a time of vasomotor and mood instability which occurs just before periods. And now you can think why that happens, because we know that estrogen is important for vasomotor and for vasomotor stability. We know estrogen is important for the normal bodily health. It gives a positive mood. It has a positive effect on the body, positive effect on the skin, on everything. And when the estrogen is going to fall suddenly, all of those positive effects will just suddenly disappear, And when they disappear, it's just like you directly put somebody, from a high to a low. And when they have a low, they'll obviously become irritable, and then a lot of things can happen. It doesn't happen to everybody, but this is something which can occur, and this is because of the sudden fall in estrogen level prior to a couple of days prior to them having their periods. That means if the period was going to be on the 1st, on the 28th or the 27th, they may start experiencing PMT, premenstrual tension, as it is called. But as you can imagine, PMT can also occur post ovulation as well. So theoretically, yes, so that there'll be two phases when you can have PMT, and both will be technically in the luteal phase, because that's the time when suddenly the estrogen levels fall, and when they are going to have vasomotor as well as mood instability. Um, so that's where with this case. Now, in the luteal phase, we have got the luteinizing hormone. The luteinizing hormone, lutein and hormone. Hormone is a hormone. Lutein means that it ensures that the uterus is well prepared. And the uterus is, how is the uterus going to be prepared? It's basically it's a muscle. It's a specialized muscle which has got a thin layer of endometrium inside. It doesn't have to be thin all the time, but it doesn't. Once again, it doesn't have to be thick and engorged all the time as well. Otherwise, there'll be continuous bleeding, like we see in menorrhagia. So in what happens in the uh, in the luteal phase, what happens is that the luteinizing hormone, it works, but it works in harmony with progesterone. The word is progesterone. Pro means for, gesterone means for gestation. So this is a hormone for gestation. Doesn't have to have any role in the first part of the menstrual cycle. So definitely you have a part in the second part of the menstrual cycle if the fertilization is taking place. So the progesterone makes sure that the uterus is very well is softened, it is very well engorged, it has blood in it, and various other things which are required for the implantation of the fertilized egg. And the progesterone effect, then it tends to wean down if the egg is not fertilized. The the level of progesterone begins to drop, and when it drops to a certain level, the period starts, the bleeding starts. The bleeding is only stopped if you've got adequate amounts of progesterone. You've got progesterone, the endometrium is going to stay full. You don't have progesterone, the endometrium is going to be shed. And now you can see that things like the coils which are kept in for contraception, they've got progesterone. There are progesterone only pills. So these are the pills which make sure that the uterus is ready all the time, and so therefore periods, the ovulation will not occur because you've got a high level of progesterone, which is going to cause a negative feedback. Once you've got over that phase, and if there is no pregnancy, on the on the on the day on the first day of last menstrual period, as we often call the first day LMP, the menstruation is going to start, and so therefore then the cycle begins again. The FSH has actually a cyclical surge. 60 to 120 minutes is a cyclical surge, so it follows the body clock, and it is affected by lots of signals. For instance, if there was a neuropsychiatric disorder, or if there was stress, there was depression, there was severe acute illnesses, anything affecting the brain is going to affect the hypothalamus. And if the hypothalamus is affected, the whole of the cycle is going to be affected, because you won't get the hormones will not be produced adequately. A quick thing about LMP, because I've just mentioned last menstrual period. Whenever we take an obstetric history, we often ask about the last menstrual period, and we often take that as last menstrual period. What is the rationale for that? Well, there is no rationale for that, right? There isn't any scientific basis for the first day of last menstrual period, because it would make you wonder. It doesn't really make a difference, because that's not the time when ovulation took place. Ovulation took place on day 14. So why do I have to remember 14 days prior to that, when ovulation didn't even take place? Because it's a lot easier to remember. The woman will likely remember the first day of the last menstrual period. It doesn't matter. She may have a cycle of about 3 days. to 5 days, it doesn't matter. She always had a first day. Even if the cycle was for 2 days, she always had a first day. She's likely to remember the first day. So that is why LMP, last menstrual period, is remembered the first day of the last menstrual period, because it's easier to remember. Nothing to do with the menstrual cycle or ovulation for that purpose. Next, a quick one about the safe period. What is the safe period? And then in the following videos, I'll talk about things like menorrhagia and think about other disturbances in the menstrual cycle. The safe period is a time in the menstrual cycle in which pregnancy is unlikely to occur if sexual intercourse was to take place. The ovulation is on day 14. The time when a woman can become pregnant is 5 days before ovulation and 1 day after ovulation. So here we are. Say this is day 14. This is day 14. 5 days before and 1 day after is the day of ovulation. It's not a safe period. Anything before 5 days is considered to be the safe period. So in other words, when the period stop, that is day 5, you've got another 9 days after that. So for 9 days, you can imagine that the six about 5 days will be the safe period. 5 days before impending ovulation, do not have intercourse because this is not a safe period. But before that, there is. So, for instance, if we say the ovulation was on day 14, you go back 5 days, and that's going to be day 9, so 9th of the month, and you go back about 4 or 5 days. How many days ever there were, at the end of periods is considered to be the safe period. It can be 4 days, can be 5 days, can be 6 days. Remember, follicular phase, it tends to vary. The luteal phase, on the other hand, is fairly constant. So you may not have a clear cut line of safe period in the follicular phase. On the other hand, the luteal phase, the 6 days before the start of period, 6 days. So if the period was going to start on day 1, for instance, the first of the month, 6 days before that, and the 6 days before that is going to be, say, till the 24th. So from the 24th to the 1st, this is called as the safe period. So you've got two safe periods. One of them is just before periods, and the other one, so it's easy to remember. One of them is 6 days before the start of periods, and about 4, 5, or 6 days after the periods have ended, and that is called as a safe period. This is a period where somebody can have sexual intercourse. They're unlikely to become pregnant, but saying all that, they still have to be careful because pregnancies have been known to occur even in the safe period, because it's a natural phenomenon. Ovulation is a natural thing, menstruation is a natural thing, and so therefore you can get anomalies, you can get variations in even a natural phenomenon. Thank you.